Hello viewers. Today we will talk about reproductive health and significance of reproductive health in a society. It is a very good marks fetching chapter of biology class 12th and also important for NEET aspirants. We will talk in detail. Now we start with introduction. Watch till the end and clear all your doubt. If you want to know anything more, please comment. I will make sure that I will make another video about your topic. Reproductive health in society helps to prevent the spread of various sexually transmitted diseases and impart the ability to produce offspring having better survival rates. It also helps in maintaining the population size and avoiding unwanted pregnancies. The significance of reproductive health in a society. 1. It prevents the spread of various sexually transmitted diseases, STDs. 2. Proper medication and checkups will help in the production of healthy children. 3. Better sex education and awareness help in maintaining the population and prevent the population explosion. 4. Unwanted pregnancies are avoided. The reproductive health in India has improved tremendously over the past 50 years. The areas in which reproductive health has improved includes 1. Prevention of unwanted pregnancies by using contraceptives have shown the development of health in women. 2. Awareness of advantages of small families by using contraceptives has led to economic growth of the family. Types of contraceptive methods. Birth control methods. Intrauterine contraception. Copper T intrauterine device, IUD. This IUD is a small device that is shaped in the form of a T. Your doctor places it inside the uterus to prevent pregnancy. It can stay in your uterus for up to 10 years. Typical use failure rate 0.8%. Levonorgestrel intrauterine system and number 40, LNG IUD and number 41. The LNG IUD is a small T-shaped device like the copper T IUD. It is placed inside the uterus by a doctor. It releases a small amount of progestin each day to keep you from getting pregnant. The LNG IUD stays in your uterus for up to 5 years. Typical use failure rate 0.1 to 0.4%. Hormonal methods. Implant. The implant is a single, thin rod that is inserted under the skin of a woman's upper arm. The rod contains a progestin that is released into the body over 3 years. Typical use failure rate 0.01%. Injection or shot. Women get shots of the hormone progestin in the buttocks or arm every 3 months from their doctor. Typical use failure rate 4%. Progestin-only pill. Unlike the combined pill, the progestin-only pill, sometimes called the mini pill, only has one hormone, progestin, instead of both estrogen and progestin. It is prescribed by a doctor. It is taken at the same time each day. It may be a good option for women who can't take estrogen. Typical use failure rate 7%. Barrier methods. Male condom, worn by the man. A male condom keeps sperm from getting into a woman's body. Latex condoms, the condom most common type, help prevent pregnancy and HIV and other STDs, as do the newer synthetic condoms. Natural or lambskin condoms also help prevent pregnancy, but may not provide protection against STDs, including HIV. Typical use failure rate 13%. Condoms can only be used once. You can buy condoms, KY jelly, or water-based lubricants at a drugstore. Do not use oil-based lubricants such as massage oils, baby oil, lotions, or petroleum jelly with latex condoms. They will weaken the condom, causing it to tear or break. Chemical methods. Spermicides. These products work by killing sperm and come in several forms: foam, gel, cream, film, suppository, or tablet. They are placed in the vagina no more than 1 hour before intercourse. You leave them in place at least 6 to 8 hours after intercourse. You can use a spermicide in addition to a male condom, diaphragm, or cervical cap. They can be purchased at drugstores. Typical use failure rate 21%. Lactational amenorrhea method. For women who have recently had a baby and are breastfeeding, the lactational amenorrhea method, LAM, can be used as birth control when 3 conditions are met. 1. Amenorrhea, not having any menstrual periods after delivering a baby. 2. Fully or nearly fully breastfeeding. And 3. Less than 6 months after delivering a baby. LAM is a temporary method of birth control, and another birth control method must be used when any of the 3 conditions are not met. Permanent methods of birth control. Female sterilization, tubal ligation or tying tubes. A woman can have her fallopian tubes tied or closed so that sperm and eggs cannot meet for fertilization. The procedure can be done in a hospital or in an outpatient surgical center. You can go home the same day of the surgery and resume your normal activities within a few days. This method is effective immediately. Typical use failure rate, 0.5%, 0.1. Male sterilization vasectomy. This operation is done to keep a man's sperm from going to his penis, so his ejaculate never has any sperm in it that can fertilize an egg. The procedure is typically done at an outpatient surgical center. The man can go home the same day. Recovery time is less than 1 week. After the operation, a man visits his doctor for tests to count his sperm and to make sure the sperm count has dropped to 0. This takes about 12 weeks. Another form of birth control should be used until the man's sperm count has dropped to 0. Typical use failure rate, 0.15%. Natural methods of contraception. Rhythm method / safe period, periodic abstinence / calendar method. A safe period is a period in which there are fewer chances of fertilization. It is before the 10th day and after the 17th day of the menstrual cycle. Withdrawal method / coitus interruptus method. In this method, the penis is to be withdrawn before ejaculation. This is not effective due to its highest failure rate. Lactational amenorrhea, absence of menstrual cycle at the time of lactation. As a result, sexual intercourse during the lactation period will not lead to fertilization. Some methods to assist infertile couples to have children. Infertility is the inability of a couple to produce a baby even after unprotected intercourse. It might be due to abnormalities present in either male or female, or might be even both the partners. The techniques used to assist infertile couples to have children are as follows. Test tube babies. This involves in vitro fertilization where the sperms meet the egg outside the body of a female. The zygote, hence produced, is then transferred in the uterus or fallopian tube of a normal female. The babies produced from this method are known as test tube babies. Gamete intrafallopian transfer, GIFT. It is a technique that involves the transfer of gamete, ovum, from a donor into the fallopian tube of the recipient female who is unable to produce eggs, but has the ability to conceive and can provide right conditions for the development of an embryo. Intracytoplasmic sperm injection, ICSI. It is a method of injecting sperm directly into the ovum to form an embryo in laboratory. Artificial insemination. Artificial insemination is a method of transferring semen, sperm, from a healthy male donor into the vagina or uterus of the recipient female. It is employed when the male partner is not able to inseminate the female or has low sperm counts. Thank you for watching. Please do like and subscribe my channel.